let's go and talk about first topic, GERD. What is it? What causes it? How do we treat it? And what are the symptoms from this? A very complex topic. We're going to do a deep dive on this. So what exactly are the causes of GERD? So there are two main causes of acid reflux. This is kind of how I like to describe it. There are anatomical reasons why you have acid reflux, and then there are lifestyle reasons why you have acid reflux. So let's talk about the anatomical reasons. So if you have, the biggest reason why people have GERD is a lower esophageal sphincter that's not working correctly, meaning it's open longer and more often. So it's like having a window or door open and all this stuff goes into your esophagus. This is the root cause of why you have heartburn, regurgitation, and acid reflux. A second anatomical reason is having what's called a hiatal hernia. This is where part of the stomach goes above where it should be to cause that valve to open longer and more often. And for a lot of my patients that have a hernia, especially if it's 3 centimeters or larger, this can cause acid reflux to occur. Now, these are anatomical reasons why you have GERD. Let's talk about lifestyle reasons why you may have GERD. So number one, it could be the foods that you eat. So we know that certain foods can trigger acid reflux, whether it produces more acid or causes that sphincter to be open longer or more often. Foods like chocolate. I know, my favorite, I love chocolate, but it can make acid reflux symptoms worse. Tomato-based foods, citrus-based foods, carbonated drinks, alcohol. Pretty much all the good stuff we enjoy in life can make acid reflux worse. I will have to tell you though, it's not the same for everyone. So just because someone tells you not to have spicy foods to make your reflux symptoms worse, see how your body feels. So for me, we'll use me as a prime example. I have acid reflux and I hate acid reflux, but my trigger is beef. Whenever I have beef, whenever I have steak, especially at night, I can't sleep because I am refluxing all night. Despite whatever I do, it makes my symptoms worse. So see how your body feels. Another lifestyle reason is eating too late. This is why you cannot eat late. Your body needs time to digest, at least 30 minutes to an hour after you eat. You cannot lie down, because if you do, that food sticks in your stomach and causes regurgitation, fermentation, and gas and acidity to be formed. So this is something that needs to be taken care of. Number three, eating too much. So eating too much, having too much food, or having a big belly can cause you to have acid reflux symptoms as well. So sometimes when it comes to reflux issues, we have our patients eat smaller, frequent meals throughout the day, or try to lose weight, which is probably the most effective way you can get your acid reflux taken care of. Also too, other lifestyle things that can cause reflux symptoms to get worse, starting with things like pregnancy, which goes along with obesity as well. All right, what are common symptoms of GERD? So there are two main conditions that if you have, I'll tell you have GERD. One is heartburn, which is burning right here, or regurgitation. These are two most classic symptoms when it comes to GERD, but you can have a lot of other symptoms as well. Chronic cough can be related to GERD or acid reflux. You have throat clearing. It can be related to GERD or acid reflux. Trouble swallowing. It can be related to GERD or acid reflux. If you have constant ear infections, that can be related to GERD or acid reflux. You see a theme here coming on? It's the same thing over and over again. And so non-classical GI symptoms can be associated or be part of acid reflux and the kind of the heartburn spectrum as well. But if you tell me you have heartburn or regurgitation, that's all I need to do to diagnose somebody with GERD. What's the big deal about GERD? Let me tell you. Now, GERD can cause your quality of life to suck, absolutely. When I have GERD, it sucks for me. I don't sleep well, I'm in a bad mood, I'm just irritable, it's not good. They can lead to complications. One of the biggest complications you need to be aware of that a lot of people don't realize is cancer of the esophagus. It is such a sad scenario when you have somebody who's had chronic acid reflux who all of a sudden develops cancer of the esophagus. This is why you need to get it checked out. Don't ignore this. Let me tell you a story of a patient of mine. I had a 55-year-old man, long-standing acid reflux, never got it checked out. That wasn't a big deal. Took over-the-counter Tums and Rolaids. All of a sudden, he started having trouble swallowing, just a little bit, but enough to cause him, hey, what's going on here? So I did an EGD on him, and I found cancer. An esophageal cancer is one of those cancers that by the time you find it, unfortunately, it typically is too late. It's already spread and can already cause a lot of problems. So don't ignore your reflux. Get it checked out because you may be at risk for developing complications like cancer. All right, now that I scared the living bejesus out of you about reflux, what can you do to fix this? Let me talk about my recommendations. So number one, there are a lot of lifestyle things that actually do work. I mentioned before, weight loss by far is the most effective and efficient way to get your reflux taken care of. If you are overweight, you need to lose that weight. It will decrease your risk of developing acid reflux. It will also decrease your risk of developing complications from acid reflux as well. Number two, avoid late night meals. Don't lie down as soon as you eat. Wait at least a couple of hours afterwards. Number three, go for a walk after you eat. That walking will aid in digestion. It'll allow things to pass through easier and help out when it comes to acid reflux symptoms. It actually does help. Next, try sleeping elevated with the head of the bed a little higher. This can help out when it comes to nighttime reflux as well. And sometimes incorporate some of the dietary changes like adding fiber or eliminating those trigger foods can help out when it comes to acid reflux. That's option number one. Option number two, we have medical therapies. They work and they are effective. You have the over-the-counter treatments like antacids or things like that, which can help with short-term reflux. You have what are called H2 antagonists, which are medications that are also available over the counter. Think of Tagamet or Cimetidine, which work well. They're not as effective as the PPIs, but they do help out with reflux. The biggest side effect with these H2 antagonists is that they can lose their effect after about 12 weeks. So it's not uncommon for my patients who take these medications to have recurrent of their symptoms a few months later. Then you have what are called the gold standards, the PPIs, the proton pump inhibitors. They work, they are effective, and they help out when it comes to acid reflux. These are what we call the gold standard. They actually do help out. Now, a lot of patients are on these medications, and a lot of my patients are confused about the side effects of these medications. So let me tell you what I tell my patients. And as always speak to your healthcare provider about what you need to know. So number one, make sure you're on the right treatment for the right reason. If you're on a PPI and you don't know why, ask your doctor. Don't just take a medication because you were placed on it years ago. Number two, you want to put yourself on the lowest dose possible to control your symptoms. So I always talk to my patients, let's see if we can maybe minimize the dose as much as we can to see if we can help out with your symptoms. Number three, I always incorporate lifestyle changes to either decrease the dose or minimize the effect of those side effects. What are the side effects that we know of? So you're gonna see a lot of things on the news. Here's what we know for sure. Keep in mind, this is not a comprehensive list. If you want me to do a comprehensive video on this topic, comment down below, let me know. We do know there is a risk of absorption of certain vitamins, calcium, vitamin D, magnesium, and B12. We know for some individuals, you have a deficiency of that. We also know that for some individuals, especially postmenopausal women, there is a possibility of an increased risk of hip fractures and osteoporosis. Not everyone has this, but it can be. We know for some individuals, you can have an allergic reaction to your kidneys. Not kidney failure, but some sort of what's called interstitial nephritis of your kidneys. We know for some individuals, it may possibly change your gut microbiome. We know for some individuals, it can put you at risk of developing infections like C. diff and pneumonia. What we do know is that it does not increase your risk for Alzheimer's. We also know it does not increase your risk for chronic kidney disease. A lot of people stop these medications because they're worried about this. Let me tell you, don't stop the medication on your own. Always speak to a doctor like me so we can find out why you're on it and get things taken care of for you. But if you have reflux issues, if you're wondering, should I be on a medication? Should I take this pill? Is there other options? Come see us at Celebrate Gastro. We can delve into the science of why you have heartburn, but also see my videos. I have tons of videos on this, and join me on my live stream as well where I can talk about this as well. So I hope this is a good deep dive on everything that you need to know when it comes to acid reflux and what recommendations I have.